before the Affordable Care Act. The way things were before the Affordable Care Act were very uneven from state to state, but suffice to say, nearly 50 million Americans didn't have health insurance, and of those, an estimated 12 million had a diagnosable mental health condition or substance use disorder. People with chronic mental health or substance use conditions face denial of insurance or high and usually unaffordable premiums, so they tended not to have insurance for that. And there were fewer Americans who were living around the poverty level who received benefits through Medicaid programs because the eligibility requirements were tighter, both in terms of income levels and categories of eligibility, such as most states did not cover adults who did not have children. So things were definitely not great for a lot of us. So under the prior landscape, the cost of care, the lack of health insurance, the requirement for pre-authorization, and limited provider networks were all impediments to us receiving mental health care. They varied widely from mental health benefits varied widely from state to state. Many employer-sponsored plans did not offer mental health care. When covered, the benefits were significantly more limited, and the sort of only saving grace at the time was that children who otherwise didn't have access to health care did receive insurance through the Children's Health Insurance Plan, known as CHIP. There were also some trends going on that were not favorable to people needing insurance, which, of course, is all of us. There were stronger trends toward cost sharing, so that co-pays came into more sizable amounts. Deductibles were also raised, and fewer employers were offering health insurance. So mental health benefits weren't covered, and when they were covered, they were very restrictive. And the thing to know about the cost sharing is that this also had a significant impact on the people who were least able to afford it. For people with mental health conditions, there is a probability that they had lower incomes and were less likely to afford out-of-pocket expenses. So these were troubling trends. With Medicaid covering mental health, it's important to note that about a third of Medicaid beneficiaries were affected by diagnosable mental health conditions. Low-income people tend to have rates of mental illness that are 6 to 8 times greater than that of the general population. So this, combined with the cost sharing, made it very difficult for people to access care when they were of lower income. There also was no uniformity from state to state, so that you could be across the border from someone who had very good mental health benefits, but your state didn't offer the same thing, so your family didn't have access to them. The bottom line is that before we had the Affordable Care Act, which people tend to refer to as Obamacare, 3 out of 5 adults with a recent mental health disorder did not receive care from either a general medical provider or a mental health specialist. So this was really something that we wanted to go after.